Hello, my name is Steve Rodriguez. I'm a family practice doctor, and this is one of my treatments for face pain syndrome, trigeminal neuragia, whatever you want to call it. But let me get something straight. There's no such thing as trigeminal neuragia. There's face pain syndrome, face pain. But once you give it a name, you lose faith with what it truly is. It is pain in the face, like migraine. There's truly no reality related to migraine. There is headache, and headache can be a 1 level or a 10 level. A migraine is a 10 level headache. But if you call it a migraine, then you put it in a pigeonhole or a slot, and then you treat it as a migraine. That's not how the human body works. Pain is pain. There's only 3 types of pain: muscle pain, medication treated pain, and surgical treated pain. Muscle pain requires muscle therapeutics, and this is muscle therapeutic. This is muscle therapeutic with a thin needle. I've stopped using the term acupuncture because it's such a confusing term. I call it muscle therapeutics. Release with a thin needle. That way there's no confusion, there's no bigotry, there's no prejudice, there's no bias. It is what it is, which is I'm using a needle to stimulate Mother Nature to heal this pain. This is the worst pain you could ever have. And it's unfortunate that society chooses to allow people to suffer in pain because they won't accept the fact that this is the most important device ever created by any human being. It's amazing. This is my treatment. Now everything is a little backwards, so I might look funny, but that's how it is. So I'm using the needles this way instead of perpendicular. I tried perpendicular for years and it didn't work that well. The web system of the pain is so complex that if you look at a spider's web, you can look through it. But if you poke your finger through a spider's web, the spider can fill in that area. But if you take the whole web down, you got to grab the whole web and bring it down. Then you got to kill the spider. So there's no real rhyme or reason. I'm just going to cover this whole area. And I'm feeling as I go to see if there's anything there. When I push, I can feel the needle slide through the muscle tissue. And it's a drag. A little bit uncomfortable, right? Wrong way? Oh yeah, wrong way. That's a drag, a very, very dense drag. It won't even, it's stuck. It's going slowly, slightly. There's no rhyme or reason to this. You just stir. You just do it. Oh, that one hurt. Ouch. I'm trying to, oops. good spot right there. What I felt it jumped this way. Now when I'm doing patients, they'll give me a signal, say pause, or um, they're giving me feedback. So I'm going a whole lot faster than I would on a patient, because this can get pretty uncomfortable. And if you take your time, it's not bad at all. Oh, that's an interesting spot. So the thing is that there's no nerve pain, there is just flesh pain. And the web is so complex that it defies human logic or reasoning. Your job is just to do this, and Mother Nature does the rest. If you don't do it, ain't nothing gonna happen. Thank you. I'm gonna finish it. I need a mirror for the rest of it. Thanks.